World Mental Health Day, October 10, 2020. World Mental Health Day, a program of World Federation for Mental Health, was observed for the first time on 10th October 1992. The main objective of this program is to raise awareness of mental health issues around the world and mobilizing efforts in support of mental health. Every year, they come with new themes. This year, 2020, the theme is Mental Health for All, Greater Investment, Greater Access, Everyone, Everywhere. I repeat, this year's theme, 2020, Mental Health for All, Greater Investment, Greater Access, Everyone, Everywhere. Mental health is a human right. It's time that mental health is available for all. Quality, accessible primary health care is a foundation for universal health coverage and is urgently required as the world grapples with the current health emergency. We therefore need to make mental health a reality for all, for everyone, everywhere. Mental health is one of the most neglected areas of public health. Close to 1 billion people are living with a mental disorder. 3 million people die every year from the harmful use of alcohol. World Health Organization states that every 40 seconds someone dies by suicide. Annually, this represents over 8 lakh people that die by suicide, which is more than people dying by war and homicide put together. The world is experiencing an unprecedented situation due to global health emergency due to COVID-19 that has also impacted on the mental health of millions of people. Fear, anxiety, isolation, social distancing and restrictions, uncertainty and emotional distress are experienced a lot. Relatively, few people around the world have access to quality mental health services. In low and middle income countries, more than 75% of people with mental, neurological, and substance use disorders receive no treatment for their condition at all. Furthermore, stigma, discrimination, punitive legislation, and human rights abuses are still widespread. Limited access to quality, affordable mental health care in the world has been further diminished due to COVID-19 as the pandemic has disrupted health services around the world. Let us see some of the health arguments related to mental health. Close to 1 billion people have a mental disorder, and anyone anywhere can be affected. Depression is one of the leading causes of illness and disability among adolescents and adults. 1 in 5 children and adolescents has a mental disorder. People with severe mental disorders such as schizophrenia tend to die 10 to 20 years earlier than the general population. Suicide is claiming the lives of close to 8 lakh people every year, one person every 40 seconds, and is the second leading cause of death for young people aged 15 to 29 years. These are the global data. Let us see some of the care gaps in mental health. Relatively, few people around the world have access to quality mental health services. In low and middle income countries, more than 75% of people with mental health conditions receive no treatment for their conditions at all. The serious gaps that still exist in mental health care are a result of chronic underinvestment over many decades in mental health promotion, prevention, and care. The investment deficit. On average, countries spend less than 2% of their national health budgets on mental health. Despite an increase of development assistance for mental health in recent years, it has never exceeded 1% of development assistance for health. World Mental Health Day is simply not a one-day event. and provides us with the opportunity and advantage to hold the attention of governments, donors, policymakers, and all stakeholders to ensure action for greater investment in mental health. Mental health professionals, let us hold hands and unify our voices in moving the mental health investment agenda for increased focus and access to mental health and thereby making mental health a reality for all, everyone, everywhere. Thank you for patient listening.